I would do sports in high school and try to work out, and my hips would just click and pop, and I'd be sore and just uncomfortable sleeping. I just couldn't sleep well at night, and it was to the point it was very annoying. I saw at least 10 doctors, and they all were like, yep, there's nothing wrong, you just need to stretch, or you're fine, just keep running, keep doing what you do, you're just growing still, you're good. And it was just really annoying and frustrating at the time. They've told me physical therapy before, but it always made it worse. So then that's when they knew that it would, some people knew it was more, and that's why I got an MRI, because I was out in Minnesota going to school, and I was by myself figuring this out, and they're like, do physical therapy. If it doesn't help in 3 months, you need an MRI. Well, I did that, and then they're like, they saw the MRI, nothing was wrong. And they're like, well, you can continue physical therapy. I'm like, no, that's fine because it hurts, so I'm not going to continue to do it when it's not doing anything. And the physical therapy was just making it worse because it was pinching my labrum, and what really happened was my joint wasn't fitting into my socket, so I had extra bone over my socket, so it was clicking, and it wouldn't fit in properly. So Dr. Henry shaved off the extra bone and repaired the labrum, and it's crazy that God gave me extra bone, I guess. I noticed within 2 weeks after surgery my hips felt so much better. I remember telling Dr. Henry that I just felt so much better after, I felt I could run, especially after my second surgery. I was like, I just want to get done. I have 3 more months of therapy, but I just wanted to be able to, my goal was to run, and I was able to, and I ended up running my first 5K this year because I never was able to. To tell it, all the people who said it was crazy that I wasn't. They constantly would say that, and I mean, my dad at times would be telling my mom, why is she going to all these doctor's appointments? It's kind of ridiculous, and she already had an MRI, and I mean, I had an MRI, and the doctor said there was nothing wrong. And I brought in that MRI to Dr. Henry, and he's like, yep, there's a slight tear there. So that was frustrating, because you spend that money and then he didn't have an answer. He was very personable. He always he flat out told me what was wrong, and I was just kind of relieved that I finally had an answer. And I had a few complications, but it was just normal. I had a spasm, and I could call him, and he got a prescription for me right then and there. So it was nice that if I had a problem, my mom would just call and be like, this is what's happening, what do we do? And he would, if he didn't answer right away, he'd call back within 5 minutes.